Breast Cancer 101 with Dr. Florence DiBiase and SafeChair. Para subtítulos en español, vaya a YouTube. Hi, welcome to another episode of SafeChair Podcast. Today I'm here with Florence DiBiase, a physician at Stanford University. Could you please introduce yourself to our audience?
Sure. I'm super excited to be here. Thanks for inviting me. I am one of the general obstetrician and gynecologists here at Stanford. So I do everything from delivering babies on labor and delivery to prenatal care to routine gynecology care like your annual exam, and then also gynecologic surgery. So I'm here today to talk a little bit about screening and prevention of some gynecologic cancers, and happy to share any knowledge that I have.
Perfect. We're going to be making 3 episodes with Florence, and we're going to be talking about breast cancer, cervical cancer, and anatomy. These are meant to be more educational episodes, so they're less about opinions, but more about the facts of biology. So I wanted to start off by asking you, what is breast cancer and how does it develop?
Yeah. So cancer generally is something that can happen in the body when we have tiny little building blocks in our bodies made out of cells. And usually there's kind of a set of rules that those cells follow. So, they divide at a certain frequency, they have a certain lifespan, they die, and then they're replaced by new cells. But with cancer, sometimes those cells kind of don't follow the rules and they more rapidly divide and multiply. And when that happens enough, that can form something called a tumor, which many of you may have heard of. And sometimes that tumor can grow to the extent that it even spreads to other parts of the body, like the bone or the lungs. And so our goal is to catch cancer early. Breast cancer is when that process happens in the breast. And it's a super common cancer, unfortunately, in women. It's the most common cancer we diagnose in women. And we think about 1 in 8 women will have it in their lifetime. So pretty high, about 13%. So definitely something worth knowing about for you and recognizing kind of how to prevent it. There's a couple different types of breast cancer, and we don't have to get into the weeds here in terms of details, but it depends on what type of tissue in the breast that those abnormal cells grow from. So, there's some ducts and some little sacs in which milk is produced. And so depending on where the cancerous cells grow, it's different types of breast cancer, and the treatment might be slightly different. The good news is this doesn't happen like overnight. Usually it happens over a longer period of time, months to years. And so looking out for warning signs, knowing how to stay on top of screening is important for breast cancer. And why this happens, there's a number of different reasons that people can develop breast cancer. But we think it has something to do with, damage either to our DNA or a genetic predisposition, meaning that, you might have a gene that makes you at higher risk of breast cancer.
Wow, since it's so common, it may seem scary a little bit that this could happen to anyone, but knowing about what exactly is happening behind the scenes with the cells, like you just described, is really helpful to put the mind at peace.
Yeah.
And knowing what are the risk factors for breast cancer. I know you said part of it is genetics, but what are the biggest risk factors for breast cancer people should know about? What lifestyle habits can they develop to lower breast cancer risk?
Sure. The biggest risk factor is just as we get older, age. And, as we get older, there's damage that happens to our bodies, to our genes. So that's one of the risk factors. Also, having a family history, particularly if you have a mom or a sister or a daughter with breast cancer, or even other types of cancer too, that can increase your risk, particularly if it's what we call a first-degree relative or someone who's very close to you in terms of relation. There are certain gene mutations that we're identifying more and more to be associated with breast cancer. And so some folks, if they have a lot of family members with a condition or they develop breast cancer themselves, they'll be eligible for genetic testing to identify some of those mutations. And, again, we're always identifying new ones, but some of the most common ones that can be associated with breast cancer you may have heard of are the BRCA or BRCA genes. There's a 1 and 2. And those can significantly increase your risk of breast cancer and also other types of cancer like ovary cancer. Other than the genetics that we talked about in age, Also, some of your lifestyle habits are fortunately within your control to modify. We know that drinking alcohol, even if it's, moderate use, can increase your risk of breast cancer, as well as, being overweight or obese. We think having extra fat tissue in your body can increase the amount of estrogen, one of the hormones that can be implicated in breast cancer. And the good news is, you can do things like diet, healthy diet, and regular exercise. And there is data to say that those reduce your risk of breast cancer, which is good.
That's really good to be aware of and put mind at ease when you're well informed about what could be causing it, and that it's not just something that magically occurs, but that there's some stuff that you can control, but there's some that you cannot control.
For sure.
Another thing that is helpful to be aware of and is also somewhat in our control is what are the signs to look out for on our body, and things not to ignore.
Sure. Yeah. So certainly if you feel a lump in your breast or even in your underarm, your breast tissue goes all the way up into your armpit, which not a lot of us know. So if you're feeling a lump there, definitely I would advise you to seek care to figure out exactly what that is. It can sometimes be a little bit more subtle and you don't feel a discrete mass. It can be, a change in the shape or the size of your breast. You can notice changes of the skin, like you can have like a little dimple, or the nipple can kind of turn inside out, what we call inversion of the nipple. Sometimes people have leakage of fluid from the breast. It can be bloody, it can be clear. So especially if that's only on one side or bloody, we get a little bit more concerned about that. Also, breast pain that doesn't go away. A lot of women have pain with their menstrual cycle in their breasts or breast tenderness. But if it's continuous and it doesn't resolve, that's a little bit more concerning. The fortunate thing is if you find a lump in your breast, I don't want you to be too worried, in the sense that like it doesn't necessarily mean you have cancer. There are a lot of other things that can cause that lump that aren't cancer, but it's definitely, concerning enough that you should get it checked out.
Yeah, always good to see if anything concerning, to get it checked out, talk to a doctor, a health practitioner. It's very important. And then when should someone start screening for breast cancer? And what are the screening methods that are available? And then the other question on top of that is, how do family history and genetics change screening recommendations?
Yeah, so tons to talk about in this question, and it can be a big source of confusion for patients. So I want to break it down a little bit here. So the most, let's start with the fact that, screening is super important, because if we can identify a breast cancer before it becomes something that you can feel, or that, is kind of clinically significant, you're symptomatic, then it's usually easier to treat on a lower kind of stage. So, it's easier to achieve what we call remission, or clearing the cancer from your body, so that, your long-term risk is much lower. And so screening tests who have no symptoms is the goal, and people who have no symptoms is the goal. And so one of the first things, easiest things that I recommend people do is get to know their breasts. We used to recommend self-breast exams for patients who have breasts. And we learned that that's not really an effective screening tool per se, and it caused a lot of anxiety for patients because they would feel something, they would be worried, they would go to their doctor. Now we're kind of recommending more what we call breast self-awareness, which just means knowing what your breasts look and feel like at baseline, so that if there's a change, you will realize it. But the other piece to this is really just imaging screening, and potentially even a clinical breast exam with your doctor. So there's a lot of different societies who make recommendations about breast cancer screening, which can be a little bit confusing to interpret. But most of them, in people who are average risk, which is the majority of women, recommend starting at age 40 or sometime in your early 40s. And then the frequency of screening, how often you should get that test, is usually once a year, or at minimum or maximum, I guess, every other year. Most recommend every year. And that's what I typically recommend to my patients. Another thing that you can do kind of before we get into the nuances of the screening test is kind of take charge and understand what your individual risk is for breast cancer. There are a number of risk assessment tools that try and give you kind of a percentage. How likely are you to develop breast cancer during your lifetime? And that's based on things, like your pregnancy history, whether you breastfed your kids, your family history, a number of different things. And so, one of the most commonly used ones that I recommend for my patients is called the Tyrer-Cuzick Risk Assessment Tool. It's been studied quite a bit, and it's available for free online. So if you feel comfortable kind of doing that yourself, you can look that up and complete it and show it to your doctor. But for a lot of folks, it's a lot of medical jargon. They'd rather kind of go through it with their provider, which we're usually happy to do too. If your risk assessment comes back as 20% or higher, you're kind of in a different classification and you're considered higher risk for breast cancer. And so oftentimes in that situation, we'll recommend seeing a breast specialist, either for a consultation or ongoing care and recommendations. And typically they may recommend starting screening earlier or doing some additional screening tests compared to your average risk person so that we don't miss a breast cancer. So we can talk a little bit about kind of the specific tests that we offer.
Yes.
The most common one that folks might be familiar with is called a mammogram. And this is a special kind of like almost like an X-ray of the breast. So it's black and white. It involves this very, very tiny bit of radiation, and it helps us see the breast and any potential abnormalities within the breast. There's kind of a newer version of this technology called tomosynthesis. It just helps us visualize the breast a little bit more in 3D, and it's better at picking up small masses of the breast than the classic mammogram. I'd say most providers are able to offer the tomosynthesis at this point. And that's the one that we kind of recommend annually for most folks. There's some additional things that might be recommended. One, if the mammogram isn't conclusive enough. So like the radiologist, the doctor that reads the mammogram says, I think this is okay, but I'm not 100% sure and I want to be sure. So let's get an additional test to help us figure that out. Or, some other risk factors are present that might, entail, different studies. So some other studies, we can do the mammogram and we can also give a special dye called contrast to help highlight masses that wouldn't be visible on a normal mammogram. That's called a contrast enhanced mammogram. There's also an MRI, which is a study that uses magnets as well as contrast dye to take kind of very detailed pictures of the breast. We almost exclusively use that type of screening test in people who are high risk or that lifetime risk is greater than 20%, mostly because it has a higher risk of what's called a false positive, or finding something that we think is a cancer that's not actually a cancer. And so we don't tend to use that in people who are low risk because it can result in kind of more invasive testing that isn't needed and a lot of anxiety for patients that something's wrong. The last test that we sometimes use is an ultrasound, and that can be kind of an additional supplemental test if we don't have kind of enough information from the mammogram as well. And that uses kind of sound waves to take pictures of the breast, so slightly different type of technology.
Thank you for the really clear explanations for all the technologies and like what someone should do, how they should get assessed for risk factor, and then going to a physician to determine what is best for them. So this is like really clear and amazing explanations. And more on building on top of that, could you explain what are dense breasts? How does this impact someone's cancer risk in screening?
Yeah, I think this is gaining a lot more attention in the media more recently in terms of our understanding of breast tissue and kind of risk and interpretation of screening. So everybody's breasts are a little bit different. One thing that tends to happen as we get older is our breasts go from being more dense, so more of the tissue that helps produce milk and transport milk, and the tissue that kind of holds the breast together, and it transitions more to be made of more like fatty tissue, which are both normal parts of any breast, but the kind of ratio changes over time. And so fat tends to look black on a mammogram, whereas dense breast tissue tends to look more kind of white. And unfortunately, masses or cancers also tend to look white. So when you have dense breasts or more density to your breasts, it can be harder to detect masses because you're looking for something white with a white background versus white with a black background. Makes sense, right? So people who have dense breasts, it's harder to find breast cancers too. And actually having an increased density of your breast also very slightly increases your risk of breast cancer to someone compared to someone who has fattier breasts. So it's kind of like two things to know about. We do have kind of like a medical terminology to classify the density of breasts that's reported on every mammogram. So you should have access to the density of your breasts so that you can be informed about making decisions with your doctor. And it goes from A, which is almost entirely fatty tissue, to D, which is extremely dense breasts. And then B and C are kind of somewhere in between. Women who have category C or D breasts tend to be considered to have dense breasts. And in that situation, when we combine that with age and risk assessment, we may recommend some additional studies other than the tomosynthesis mammogram to better understand, whether a breast cancer is present. For example, we talked a little bit about the contrast enhanced mammogram. That can be a helpful tool. One thing I want to go back to that I forgot to mention before is the clinical breast exam. And that may be recommended by your doctor as part of your kind of annual well person visit to assess for any lumps or bumps that you maybe haven't recognized. Depending on which society you look at, for example, I follow the American College of Obstetrician Gynecologists guidelines. It's kind of our national guidelines for OB/GYN. We typically recommend an annual breast exam starting at age 25 every year. But there's, varying guidelines. Some people don't really feel that that's as helpful as the screening tests we've talked about. So I encourage patients to talk with their healthcare providers about kind of what their practice is, what they recommend, come up with a plan together.
Yeah, that's really good to know that exactly what your provider is going, which recommendations they're following, and which one of these societies that are giving out the recommendations they're following along, because some of the information that these societies are publishing are also available online. So anyone, even you can just go online and read this as well. For sure. To wrap this episode up, if someone listening wants to be proactive today, what are the top 3 steps they should take?
Yeah. So the first thing I'd recommend that, everybody do is get to know your breasts if you have breasts. And we estimate about half of cancers in women who are 50 or older are actually found by the patient themselves. So knowing your breasts and detecting when there's a change is one of the best ways to kind of find and treat breast cancer early. We think even more than half of breast cancers in women who are less than 50 are found in this way. So that just kind of includes the way they look, the texture, whatever. And for some women, that can feel a little bit uncomfortable at first, but no, like this is part of your body and your anatomy, and we want you to feel comfortable with that. The second thing I'd recommend is if you don't have a regular doctor that you're seeing, either a primary care physician who's comfortable doing breast care or a gynecologist, most of whom are comfortable doing breast care, and just kind of have a regular cadence of visits with them, seeing them every year, every other year, to make sure you stay on top of your screening and, understand how to reduce your risk with the things that we were chatting about. And then the last thing that's a little bit more kind of complicated is understanding your risk and maybe exploring one of these calculators that we talked about online, either on your own or with your doctor. And you'll probably need to talk to some of your family members to understand, your family history of cancer, other things that could contribute, and whether you need specialized screening because of that history.
Thank you so much for this information today. This was a wonderful episode about breast cancer. Please feel free to share it with anyone, any family members that you think would benefit from this